Good morning. Today we are going to discuss history taking. Now, I want to remind you that we are discussing knowledge for a general practitioner. Now, which medicine we are talking about? Allopathy, homeopathy, Ayurvedic, acupuncture, acupressure, naturopathy, passage of time. General practitioners can practice any of these. This is my addition, passage of time. Because in most of the illnesses which you are going to see in general practice, it's the passage of time which works, whether it is viral fever, whether it is any other complaint. Now, talking about allopathy, I want to remind you that so often you loosely compare and think of other pathies. They are all good, there is no question of that. You see, Dr. Devi Shetty, who is one of the biggest surgeons in India, he was talking in his lecture where he said his wife developed severe backache. He says all X-rays, MRI, etc. are okay, tablets are not working. Somebody took him to acupressure. He says one sitting of acupressure and the backache disappeared. And he is not telling lies. He must be right. I mean, all these pathis must have worked. That's not the point. But today I want to remind you about this, that the pathy which you are practicing is allopathy. Now, allopathy is really speaking medical, surgical, interventional. Surgical, today it is advancing at such a fast pace, you cannot believe it. They are putting new lungs. Of course, new kidneys has become a very, very common operation to put a new kidney, lung, heart. So, surgery, liver transplant. So, transplantation of all the organs has been conquered. New knees. I want to draw your attention to this. Now, our allopathy is advancing very fast in interventional medicine. Interventional medicine means what? Means you are doing all these surgeries will be done without cutting. Without cutting. You will be surprised where we have reached. That, for example, endoscope can be put through the top and so many operations of the stomach can be done. Forget about that. You can put an endoscope from the bottom, from the anus, and enter the abdominal cavity and then do any surgery you like. Colon surgery, kidney surgery, any surgery. I mean, imagine, nobody can make out. There is not even a scar of a endoscopy here because you have gone through the anus. And today the same thing, interventional, is coming on the medical side in the sense that for the heart fellow is going in the coronary artery, putting a stent. Yes, gastrointestinal fellow is going in the bile duct, common bile duct, and removing the stone. I would advise you, I think many of your doctors, your children are gone for medical courses. Please see that in future you make them interventional doctor. Believe me, it will be on the top. Don't try for medical and surgical. Coming to medical either a GP or a consultant. Consultant cardiologist, neurologist, hepatologist. I personally, I'm running 90 and any of these days my wicket will go down. But if I am born again and if God makes me again a human being, I would like to become which doctor again? GP, not a consultant. I am telling you, the GP specialty is such a beautiful specialty. You cannot compare it to any other specialty in the world. Your relationship with the patient is, he becomes a part of your family. He is an extended family. Every patient who comes to you is your extended family, your relation. He is not a customer. All other specialties, a customer. Cardiologist came, he did this, or gastroenterologist did, patient went away, forgot. Customer. Like you go to a shop. This GP specialty is not a customer. That patient who comes to you, then onwards, he becomes, you are like his brother, father, mother, relation, friend, teacher, doctor. You are everything for that patient and a God. He takes you as God. You tell him, I am not God, I am a God's agent. That you should go on clearing every time. But this relationship between that patient and this doctor, general practitioner, I tell you, it is something you cannot imagine. The patient can talk to you something which he cannot talk to even his guru, godman or somebody. He can't talk to his wife, he can't talk to his children, but he can talk to you. That much confidence you have to create. You don't get it from the beginning by sitting. And then that is that faith which I told you last in the earlier also. You have to create that faith. And the faith creation is by, it takes time. You have to work hard for that. For example, even history taking, which I am going to discuss today, starting of a faith. You see, because history taking, when you do, languages in India, problem is languages. You should learn as many languages as possible. And if you are in your own small town, small village, same language, no problem. No problem. Otherwise, English is becoming universal. Because if you know your language and if you can take history taking, all the people, the public has gone on the wrong impression they have got, of allopathy. That you want to make a diagnosis, doctor, so the blood tests, they are being advertised, 120 blood tests for 600 rupees, liver, kidney, wrong. MRI, CT scan, X-rays for diagnosis, making a diagnosis. 90% of the diagnosis is made by history taking. And now, in future, you will see now bad days are coming because corona days have not gone. Doctors have started doing video consultations. And in a video consultation, you have to diagnose only by history taking. See, now they are getting straightened. In the past, doctors have been following British, American doctors, like patient comes out to complain, what's your problem? Headache, so finish. No history taking. MRI of the brain, CT scan of the brain, blood test, this, that. People had forgotten, doctors had forgotten history taking. They didn't want, they thought it's a waste of time. Why to waste time? It's wrong. And I am very happy that corona epidemic has taught you one thing, that you will be forced to start history taking. Because video consultation means video history taking. I am doing also video consultation now. I retired from my clinic, consulting room. And when a new patient I get, there are times for half an hour, 35, 40 minutes I am talking only history taking. Only history taking. So history taking is something, see, but people think that it is automatic. It's like on the police station. You made an accident, you bashed some car or you made some accident, you're going to the police station, and then when you go there, that fellow is asking you, he makes you sit. And so roughly, sit down, sit down. What's your name? Mukesh, Batra. Where do you stay? What's your address? You see his method. How did you knock down that man? What did you do? How are you? See, roughness in his voice and the way in which you're tempted to tell lies, because you're frightened. He's frightening you. That is history taking. Ours is opposite. In medical, if you can take a history taking properly from the patient, you have captured him. And for that, naturally, the language comes, the words come. Even if the language, you're talking to a Hindi patient, Hindi, and you want to ask him something about, say, about some sex or something, like during the intercourse, do you do this? Very difficult question to ask and to expect a reply. So there is a method of talking. The way in which you talk, you can elicit anything from the patient. 50 years back, it happened that the Arab world got oil and they became rich. So patients from Bahrain, Dubai, Abu Dhabi, Muscat, Qatar, Saudi Arabia, Yemen, they started what to do with the money. There is no income tax. So Bombay, come to Bombay, they'll have fun, they'll have good food, drinks and doctors, best medical doctors. So all the hospitals are full of Arab patients. And I happen to have a cosmopolitan practice. So when the Arab patient came, I learned Arabic within few days only. Means you have to learn important words. You don't have to have fluent language to get a history taking. So I became very popular amongst the Arab patients. Why? Nobody used to take history. They didn't know how to talk. So only investigation. I would make them sit and take the history taking. The most difficult, for example, when we discuss someday about sex problem. So in men, the commonest sex problem is premature ejaculation. No, you have to ask the patient history, how will you take? So all I did was to pick up important words. That waqt, jug, is a lame word like a sex, for sex. It's not a correct word, but it's a layman's word. So I'll say, waqt, jug, money is semen. We also use money word in our language. Money, eg means comes. Bin sora hai. Sora is fast. Finish. All I have to do is ask this patient, Muhammad, jug, money bil sora hai. Oh, doctor, oh, he is so happy that you have understood. And he has been going to all doctors for daif. Daif means weakness. And the doctors have been doing blood tests, imaging. He now got the doctor who has understood that is his weakness. That when he ejaculates prematurely, he feels this. Wife also says, you become weak, go to a doctor. So I was telling you that history taking brought me to the fame in Bombay amongst the Arab doctors. So much so, I was in Jasrog hospital was full of patients of mine in the suites in the first class. And after I saw 6,000 Arab patients, I wrote this book on common chronic disease patterns in Arabian Gulf, which means from Bahrain, Dubai, Abu Dhabi, Muscat, Qatar, Saudi Arabia and Yemen. And this book, when it was sent for review to British Medical Journal, they were fascinated. But half of the book contained Arabic words. So they took the help of Saudi Arabia Journal editor. And they wrote down about my book. That's the only book in the world, because nobody else can write. 6,000 patients, Arabic from all these Arab countries. How can you collect? So, famous, I was on the top. And then what happened? Then in all these Arab countries, which are all rich, hospital came up with best investigations, best doctor. They got doctors from UK. And they were getting now the same treatment as in Bombay. So within 2, 3 years, 4 years, finished. Arab patients disappeared. So people who were having only Arab practice doctors, they suffered. I had a cosmopolitan practice. But my book, which that time again, second time, I lost my ambicular abscess, and I said, with this book, I'll get international name, everybody will be reading my book. Nothing happened. After 1 or 2 years, people forgot about this book. But what I was telling you, that history taking, if you can master, your diagnosis will be perfect, number one. Number two, your relationship with the patient will become very close. That is how I was telling you, he will one day become part of your family, extended family. For the marriage of his daughter, he'll call you. For any function, he'll call you. For any advice, the whole family will come to you, touch your feet. They always come and touch you. All these patients of ours, when history taking, when patient enters, they have to do namaste first. In every Arab patient used to come, ahlan wa sahlan, doctor, ahlan wa sahlan. First they want to be greeted. This is not a customer in your shop who has just come to us, what do you want? They take, go. No. And then, what all will you ask in the history taking? Some of it I'm going to discuss. You can't discuss all because it will take hours and hours. Video consultation online now is only history taking. Please remember that. So those of you who retire, don't retire in medical practice now. Now I am telling you, I didn't know in the past. That when I see people, where are you? I was working in Reserve Bank of India and 30 years I worked, now retired. Retired means what? Pension. And how much pension? Lakhs of rupees. Doctors, at the age of 65, 70, he became old, he retires. After that, nothing. Zero. No. You now remember that when you people become very old, you can stop your clinic, you can close your clinic, sell it, but you can do video online consultation. And video online consultation, charge the patient, it's like your pension till you die, till the day you die. So please remember that video consultation will be history taking, what I am discussing today. You should become good in that. Most important, the records. The weakness of all GPs is those doctors beat you. All over the world they'll beat you. Why? Because they've got computers. Computer record, everything is being recorded in the computer. You don't have computers. And I am discussing middle class practice of middle class patients, So there, you also will not have a computer, but you must have a file, small file of every patient, or a card, whatever you want, where you should write these important findings, what you got from the history. And that is the record which will help you to start your faith in your patient, relationship. Because when he comes after 3-4 years, and he talks about he had some food poisoning, he ate something wrong and all that, and now he has so many vomiting, so many. And then you ask the patient, Mukesh, what happened about your piles which you had? Oh, they become alright. And what happened to your blood pressure? You used to be a little high. Now after 3-4 years, what has happened? He will be so impressed, I'm telling you. That doctor remembers everything. Mukesh, you used to smoke 5 cigarettes. Have you stopped them or you have increased them? You used to take 2 pegs of whiskey. Have you increased? I mean, he cannot believe it. He says, my doctor, oh, he remembers everything of mine. He knows everything of mine. That is the starting point of the faith which I was discussing. That is how you create faith. So you have to have a file and a record. So by the time he has sent a word, a patient name Mukesh, then you open the thing. Before he enters, you have seen. His name is Mukesh Batra or Mukesh some Brijchandani. You call him by first name. By first name, always remember that. The name of your patient is to be the first name. You have to, every time now in future, when you talk to him, you are taking history, you start taking history, use the name in every sentence. This is how you are creating nearness, relationship. Mukesh, how many illnesses you had in the past? What did you have in this? Mukesh, what happened with that stone when you said? How was it removed? Mukesh, you said, every time you use a word, that is going to create relationship. And remember that all the illnesses which you have, they, in your general practice, the physical illnesses are 55%, 45%. 55% are illnesses due to mental, sexual, social, etc. So when you say health of a patient, he is very healthy. Only physical weight and all is very good, he is muscular, right? No. What is his mental health? Mental health cannot be seen, cannot be examined, therefore people go and look for gurus. Therefore so many cults are going on. In India, we have got maximum in the world. And all these gurus and now lakhs of people, most of them are earning crores of rupees. You people will never dream of a crore rupee. And it is because of you. Because you have done this wrong, that you have not attended to mental health. Therefore they go there. You will attend to the mental health much better than all those gurus. Because each patient is different. You cannot compare two people. Sexual health. In my opinion, sexual health is the most important health, part of health. Physical, and all these spiritual people, all these cults and all that, they don't want to talk about sex. They don't want to talk about sex. So you can't talk to them anything about your sexual. Whom will you talk to? GP. There you will see, I'll be discussing in future separate subjects. Maybe one day we'll be lecturing only on sexual health, social. But I'm telling you, what you can get the history out of him. He cannot tell that gurus forgot, they were not here. He cannot tell to his best friend all about his sexual weakness. Social health. You have got so many types of religions, societies and all that. Good, all are good. All are good. There are so many Hindus or Jain patients, so they have starving months a week. Upvas, what they call it. It's good. It's very good for health. It teaches discipline to your stomach. Stomach needs to be taught discipline. Please don't underestimate these things. Giant community, they have starving for as 10 days, 15 days, 23 days. And I have been studying, following up all these people. 23 days they go to work, but only drink water. Only drink water. And I call them to my clinic after 23 days to examine them, blood pressure, pulse, is cardiogram, everything, blood test, sodium, potassium, electrolytes, sugar, everything normal. Everything normal. You cannot, we all know so much about abnormal medicine, but normal things we are very poor up to now. What a normal health can do, body can do. Unbelievable. When I see such patients, so since you people have not taken interest in all this, so these gurus and cults and all, they start taking advice. Nowadays, so physical illness is being invaded by these cults and gurus. This much water you should drink every day. This many chapatis you should eat. This food you must take. You must take vegetables, dry fruits, fresh fruits. See, it is no good. You know your patient. That poor patient cannot afford to buy. Do you know vegetables, fruits? One apple is 50 rupees. One pomegranate is 100 rupees. And this poor husband, wife, 2 children. How do you expect them to spend all this money? It's not possible. Vegetables are so costly. So costly. Fruits and dry fruits, 1,000 rupees for a kilo dry fruit. Don't encourage them for all these things. Let them have normal diet. You will be surprised. Some 10, 20 years back, Lancet journal, the topmost medical journal, wrote that the Indian thali, in the maybe dal, bhaji, chapati, rice, and some chutney or something, is the best in the world for diabetic patient. It was put as the best diabetic diet once upon a time. Anyhow, what the important thing is that who will look after this vaccine? See, in the past, people did not believe in the vaccination. Even now, there are some societies in America, small, they are against vaccination. Now that coronavirus came, in 1-2 years, the whole world has learned, most illiterate person has learned what is vaccination. How can you go against vaccination? The smallpox disappeared from the world because of vaccination. Polio, paralysis of children's legs disappeared because of vaccination. And then you must actively take part, and for all your patients, see, without asking, that, for example, you got somebody who is drinking, and he will not stop drinking, but he drinks only 2 pegs per day. 2 pegs. So he is an alcoholic. You do his sonography of the liver, it will be fatty liver. Non-alcoholic person, having a little paunch here, you do sonography, fatty liver. Fatty liver is the commonest sonography report of the liver. Alright, all you have to do is to see that all alcoholic patients who have fatty liver and all fatty liver, they get viral A vaccine, viral B vaccine. These are vaccines of hepatitis, jaundice. And if these people get this viral A hepatitis or B, which is very common, they are likely to die of jaundice, not of fatty liver. So you encourage them to take these vaccines. All your COPD patients, you will see every time when he dies, 100% he will die of pneumonia. 100%. They are so prone to pneumonia. So give them pneumonia vaccine. Give them influenza vaccine when they get infections every year. They will not ask for it. They don't know about it. But you are worried about them. This is your relationship with the patient, which you are supposed to do. So, if you don't know the name of the patient, Shame on you. Then you are like those police people, as I told you, or in the municipality. Hey, next, yeah, abhi tum aao, idhar aao. Like that you are calling people. No. As I told you, that if your name, you heard that Sanjay Nichani, no, call him by Sanjay. Use that name every time you are taking a history, throughout history taking. Age. You know, I can talk on 1 hour on age and diagnosis. There are certain illnesses which will come at certain age. It's only from there you make a diagnosis. Elderly man in the family, head of the grandfather, who was very healthy every time, everything. Now he started getting headaches. He has got a stick, he goes for a walk, everything, he is very healthy. He must have had a small bump on his head, and he must be having a small subdural hematoma in the brain. Small blood clot which can be easily aspirated. Put a little needle there, no operation, nothing. You diagnose from the history that 75, being a sick, walking around, some bump he must have had. Or an alcoholic fellow having such headache. The blood from the rectum. Common is called piles. Yes, very common. Everybody has got piles. Nothing wrong. Little blood comes off and on. But a 80 years old man, for the first time he tells you, थोड़ा खून जाता है, कोई तकलीफ नहीं है. And you can examine and see piles, but piles can be secondary piles, they're not primary. Secondary means he's got cancer of the colon, which is one of the commonest cancer, and that has produced piles. So age help you to diagnose this. You will not diagnose in young people. So when you take a history taking, you take history from the patient's mouth, relatives. Most of the doctors have got a habit that your patient is there, the relations who are there, some uncle, some this, some that, go. No, they should be there. See, your relationship is starting now with the whole family. Head of the family has come to get examined. Let me hear everything, because he might have forgotten to tell you when I asked him the history of addictions. No addiction. And somebody else in the crowd shouts, वो तंबाकू लगाता है, वो तंबाकू पेस्ट लगाती, for a woman. So you are getting extra history from the patient. So they should be invited. Now, you about the profession. You should know details about his profession. Where did he go? How did he travel? Motorcycle, train, this, that. And if he is now, recently before the corona traffic, the air traffic became so common. I used to have patients, I could not believe. Every week they will go by air, travel here and there. Now air travel, when you do, and then it comes for neck pain. So the doctor will go to neck specialist and all. So X-ray done, MRI done, cervical spondylosis. Spondylosis is not a diagnosis to be made like that. That he has got a neck pain. So by the time you are 30 years old, your X-ray will show spondylosis. Spondylosis is normal aging, grey hair, which you can't color. And these patients' pains on the neck are because of air travel. Handbag. Most of them carry handbag, which are very heavy handbag, because they don't want to put in the main baggage to save time. And then when in the plane you have to raise it and put it in the top. So that movement, that is the cause of neck pain. So how did you find out? Because you asked the history. So every profession has got some drawbacks. Is he married? Yes. You want to know. And wife, is she working? Of course you should know it. Today the days have come, unless the husband, wife, there are two salaries in the house, you can't maintain a family. Impossible. Those days are gone, and you should encourage this and explain to your patient that explain to the housewife, unless you also earn, you won't be able to run the house. She says, I'm not educated, I'm not this, I'm not. You can always find something to work. Start making something at home and sell, some stitching, etc. Children, how many children? I would like to know. Now remember that such history taking which I am now talking to you, to a new patient, should be done only on the days when there is light crowd. See, there are some seasonal days, etc. So much crowd. You can't take the details. So call the patient again on a day when you are a little less number of patients. And that's the time you ask all these details. For example, how many children he has got. Is he a boy or a girl? What is he doing? Is she studying? You want to know everything. Then his mother, father, how did your mother die? She died of stroke. Stroke means paralysis. Paralysis means high blood pressure was not treated. I am telling you, 90% I will tell you, this will be, the history will give you the answer. Mother had high blood pressure, which she never took medicines. One day she got paralyzed, died. Father, how did he die? Heart attack. At what age? What age? See, if he has died at the age of 75, 80, of heart is normal. But suppose he died at 62, then you have to. That means he had either hypertension or diabetes, which he didn't treat, or he was a smoker, drunkard. Brothers, sisters, if any of them, uncle, paternal uncle, if any of them have got history of diabetes, hypertension, hypothyroidism, ischemic heart disease, coronary artery disease, or cancer, it must be noted in your diary. All these diseases they run in the family. And when diabetes will come again, hypertension to the man whom you are examining, will come at earlier age. His father got diabetes at the age of 60. He will develop diabetes at the age of 50. He will develop blood pressure at the age of 50. Younger age, the generations, all these generations. Hypothyroidism. Hypothyroid is so, less thyroid is so common in the family. So often you get nowadays 100 reports and you see the TSH levels more than 4. Normally is up to 4. So which means he could be having hypothyroidism. Should you diagnose? Family history. If the family history is there, definitely he has got hypothyroidism. Coronary artery disease, same thing. Father died of heart, father had a stent, father had a bypass. The patient is going to very liable to get it again. Same thing about the cancer. So then you ask him about present complaint. So what is your complaint? Why have you come to see me? And then he will start a history. Remember that. Oh, so many years back I had this. Then I went I was thinking. Then I got this operating. And now, see, he's trying to connect the whole his medical history, which is wrong. Our body is like a motor car. In fact, motor car cannot live more than 10, 15 years. We people live till 75, 85. Oh, there has to be some breakdowns. There have to be. So, you cannot connect. Doctor can connect it. You cannot connect. So you have to ask him, what is your chief complaint? For which he is mainly come. Especially if there is a crowd outside waiting for you. So then stick to the chief complaint. And diagnose properly, treat properly. The other complaints, in short, you are telling him, note down. And the present complaint which he has come for. See, later on I am going to possibly take lectures on each complaint, for example. Patient has come for chest pain. How to take the history. History. Any complaint. And in the complaint we want to know onset, duration, progress. We call it ODP. If you know the complaints onset, duration and progress, you can diagnose 90% illness. I'll give you an example. That this young son of his who is in the school, 13, 14 years old, one day he developed severe pain here in the chest, left chest. And he could not breathe. Then they get worried that it's over the heart. You can't get a heart attack at a young age. Forget about it. It has to be some, while playing and all, yes, some muscular, pectoral muscle has been. Vice versa. The grandfather in the house or father who is around 50, 60 years old. One day he develops in the middle of the night, here, some heaviness, pain. He can't breathe a little bit. He starts sweating, complete sweating, and he'll vomit. And then she says it must be this, that. She brings some water, this, that. After half an hour, he's all right. Abhi theek hai, without the doctor's prescription. That is a heart attack. Heart attack, ODP. Heart attack, the pain comes, sweating comes, this thing comes, you can die, because within the maximum death is within first 1 hour. Maximum death rate. But otherwise you survive. And when you survive, you're alright. But now you have to follow the treatment of heart attack. So how did you diagnose heart attack? From the age. More so, if at a younger age, 50, if he's a diabetic, he's a blood pressure, he smokes, he drinks, he's got a paunch, he doesn't go for exercise. So the other complaints can be noted down. Because when you say the other complaints will be, which is as good as what is past history. In the past history, whatever, see now the public now is going to give you better history in the future after this corona illness have come. Why? Now public has come to know the word co-morbidity. Today's corona days, if you are fat, obese, big paunch, and if you have got comorbidity, diabetes, blood pressure, other comorbidity, and you are more than 80 years old, you are going to die. So comorbidity word has been picked up by the public now. What is that? That as you have grown old, up to 80, in 80 years you must have had some illnesses, and I must have a record of them. Like even motor car, our big garages, they keep a record of our cars. Not only that, if he has got blood tests done, x-rays done, ask him, show. Because for all you know, the patient has come for some complaint, giddiness, tiredness, he can't concentrate because of some wrong report in the blood or x-ray, possibly which is not wrong. But he has seen that report and developed symptoms. So you must see all the reports. Past history comorbidity is so important. I remember seeing a patient of CCF, cardiac failure, heart patient, who was dyspneic coughing at night, and his anti-pro-BNP was slightly high. See, anti-pro-BNP is a beautiful test to diagnose difficulty in breathing due to heart. But if the level is slightly high, it doesn't help, because then unless it is very high, then diagnostic. So he continued having, and when I saw him, when I talked about his comorbidity and all, 2 times in the past 10 years he had an attack of typical bronchial asthma, cough, dyspnea. And so I said, now this dyspnea now is due to that bronchial allergy. It doesn't mean that every time he gets difficulty in breathing, you say it is heart. Migraine, same story. The diagnosis is very easy because from the history you elicited that when, say 10 years back he had these attacks, lasted for 2-3 months, 5 years back he had, and now again he is having headache. He had an accident on the highway. The relation will come. say, डॉक्टर उसको बहुत बड़ा एक्सीडेंट हुआ था एंड ही वाज ब्लीडिंग सो मच, तो वो टाइम हमने उसी टाइम पे हाईवे पे ब्लड ट्रांसफ्यूजन दिया, बीटी ब्लड ट्रांसफ्यूजन, एंड वी शिफ्टेड हिम टू ए बिग हॉस्पिटल वेयर ही वाज ऑपरेटेड एंड ऑल. वो ठीक है, उन्होंने नेल डाला, ये डाला, दैट्स नॉट द पॉइंट. पॉइंट इज ही वाज गिवन ब्लड, and blood, where was he given blood? On the highway, in a small damn clinic. Who doesn't even know what is blood transfusion? See, this blood transfusion is, in the past I remember in early days of mine, and I used to have practice in Bombay near St. George's Hospital, where was blood donors, there was department. So people, they were professional blood donors. They used to sell the blood and used to earn money from there. But before every time they give the blood, they had to show that they were normal health. So they used to come to me for health checkup. Today the whole thing has changed completely. Blood transfusion, patient used to come, हमारे बेबी के खून बहुत कमती हो गया, डॉक्टर साहब खून चढ़ा दो, खून चढ़ा दो. No, blood transfusion is one of the most dangerous things. If it is done, it should be done in a very big laboratory. You will be surprised that the modern blood tests which are being done before you give that blood to the patient, it costs more than the blood. More than the blood. Because through the blood, illnesses, especially hepatitis virus, liver virus, viral B, viral C, plus many other HIV virus, so many viruses. Blood transfusion should be done in a big laboratory. And moment I see a patient, and he was given, he had this history, and he's come for a liver problem. Spot diagnosis. His liver problem is due to blood which he had taken 10 years back. 10 years back. That virus remains, and virus goes on. Viral B will take 5-10 years. Viral C might come after 20 years, attack the liver. Patient need not be made nervous also. Don't frighten the patient. That अभी liver हो गया तो मतलब अभी जाने का time हो गया. Vice versa. You should encourage them. अरे क्या हुआ? ठीक है, उसका इलाज करना पड़ेगा. Last time I discussed with you, I talked about cancer of the liver. You will be surprised. There was a time when I was telling you about diagnoses and all, alpha fetoprotein, etc. That's okay. Treatment. In olden days, they used to cut off half the liver for cancer of the liver. Then it improved, treatment improved. Today, cancer of the liver can be treated either by chemotherapy from outside mouth or partial resection of the tumor or interventional treatment. Interventional person will put a catheter in the artery branch where there is a tumor and give chemotherapy. Or he could put something and burn that radio frequency treat. We have advanced so much. So there is nothing to get worried. Important thing is diagnose. Asthma. Asthma, if they in the past year asthma, or it disappeared, it can come back after 20 years. After 20 years. His gallbladder was removed. So you are happy. Later on he gets severe abdominal pain after 1 or 2 years. They can't diagnose, doctors. For all you know, there is a stone left in the common bile duct. Stone left over in the common bile duct once upon a time meant death. Why? Because operation had to be done. On the operation, it was a difficult operation to remove a stone from the common bile duct. Today, nothing. You put an endoscope. Put an endoscope. Go in the common bile duct. Remove it. Finish. So, patient at the same time should be encouraged. If there is something, nothing to worry, but I should know. If he had some attack of severe cough in the past with normal X-ray, they couldn't diagnose. Now again he has got, must be asthma only, presenting as cough. Because severe cough with normal X-ray is asthma. If he had irritable bowel syndrome, with so much 30% population has got, nothing to worry, it will go on lifetime, but the weight remains normal, remember that. Weight remains normal and tongue hemoglobin remains normal. If this same patient who was having 3, 4, 5 stools per day, when he becomes old, at the age of 65, 70, one day he passes blood in the stool. Think of cancer. Because that is a comorbidity. That will go on lifetime. He can develop other illness due to old age. So many patients talk. I had some blood pressure 2 years back. 2 years back. 2 years back. And he is taking nothing now for blood pressure. He thinks it's like an attack. It's not like that. Once you had a blood pressure, hypertension, some doctor has diagnosed 2 years back, then as you increase in age, hypertension is going to come back and you will have to live with that hypertension lifetime, take a pill lifetime. Otherwise, like I told you earlier, hemiplegia, stroke. One day you will develop a stroke. Today you see very few patients are developing strokes, if you have noticed. I notice in my practice so much. Because too many people are now taking treatment for blood pressure, hypertension. Vertigo. If you had a previous attack and after 3, 4 months or 2, 3 years again you have an attack, it must be BPPV, benign paroxysmal position vertigo. Piles, if you had in the past. Tuberculosis can relapse. If you are a heavy drunkard, you develop HIV, then this will come back. Diabetes will never go. See, people want that, doctor, remove it from my body. I don't like this diabetes patient. No, it will not go. It can become normal. It can become good readings. You have to live with diabetes. I am very sorry to tell you that it is like, bad luck. It's just bad luck. Because once you develop diabetes, and you have this patient of one, you are looking after him. Very good treatment, very good blood sugar. Even then, after 10 years, there are 50% chances he'll develop coronary artery disease. 50% chances. It is so common in diabetes, ischemic heart disease. Even with normal blood sugars, you have maintained for 10 years. So after 10 years, the blood sugars will not think that you cannot develop heart because you kept them normal. Same thing about stent. I see so many patients, stents are being common for heart patients. How is the longevity of the public increasing? Olden days they used to die, average age of death was 60. Now how is it that they are living till 70, 80, 90? How? Because of this thing. Things like stent, for example. When we were not putting stent those days, people used to die at 60. Now you put a stent, live more, 70, 80. But you must tell the doctor that you put a stent. And doctor will give you real advice because he is your family man. While the person who has put a stent, he treated you like a customer. He made you spend 5 lakhs rupees and put it and your symptoms disappeared. Now you can walk, you can run, no pain. You are not treating him like a customer. You have to tell him, stent you put, now you can run, you can do everything. But ischemic heart disease is there. It is going to progress again. As you grow old, it will again you will need a stent or a bypass operation. So now you start treating this vigorously. Same thing about bypass surgery. Do you know Arab patients, especially I saw, hundreds I saw, where they have a lot of hair on the chest. And you ask them they always tell lies about the previous illnesses. They want to show off that they are healthy. They will tell in the past history nothing. I am examining the chest and I remove the hair like that and see the scar. Bypass. The bypass was, yeah. Either they forget even that bypass was done. They think bypass is done, so heart normal, they live normal life. No, it is wrong. If your bypass was done, that means from now onwards, you take the medical treatment more strictly. Reduce your weight, alcohol, Smoking, no question of that. And drugs, statins are the only thing which can lower your cholesterol. And aspirin, these are the drugs with which you live. And statin will give you larger doses after bypass, 40 milligram instead of 20 milligram. They don't. The trouble is they don't, because the surgeon treated him like a customer. So because he is not his family doctor, he can't spend time on this. He has to operate and take 6 hours, 7 hours operation. Not his business. So patient thinks he is cured. He continues smoking, drinking, big fat, no exercise, nothing. It is you who are going to look after him even after the bypass operation. So that means what? Even after the bypass operation, the family doctor, personal history, in which you ask of the appetite. If the patient has got very good appetite, most likely he is good health. Urine. How many times he passes urine? Daytime, nighttime. Nighttime, very often after the age of 55, 60, at night time people start getting up at night once or twice to pass urine because of prostate. They don't bother. But they should know it is due to enlarged prostate. And all the patients of prostate, you must do PSA, blood level, to exclude cancer. Because cancer of the prostate is the commonest cancer in males. Should be diagnosed as early as possible. Stools, constipation, diarrhea, or how many times he goes to pass through. Now, in this personal history, there are so many variations which God has made. God has made, not we. That people take advantage of that and call them illness and make you nervous. You know, in the sense that if you pass stools, you say, how often you go and pass stool? So he will say, Mukesh will say, every 2 days I pass. 2 days, not daily. Some other patient, 3 days. This is constipation. It should be treated. No, it is not. Because everybody's thing is different. Some fellow will pass a stool every 3 days, but normal stool, normal evacuation, he feels absolutely normal. Not hard, no blood. He doesn't need any treatment. It's normal for him. Some patients will pass stools every day 2 to 3 times. Morning, early morning when they get up after breakfast, sometimes in the evening. These are normal variations. I used to have this patient from Yemen, in this Arab patient. Yemen have got this habit of eating ghat. Ghat. This is pronounced as guttural ghat. Ghat. So ghat, you ask him, Muhammad, and they feel, come ghat, kulyo, aywa. This is like pan. We eat pan here in India. These are long leaves, ghat leaves. And sometimes they grow in their yard only, in their houses also. And they get addicted to chew this like pan whole day. Most of them during work, during this. And when the Yemen patients were in Bombay, the pilots used to bring fresh ghat from Yemen and sell it to them, make money. And this patient one day forced me, he said, you try it. Just try it, he said. And he brought this, and I took it, one leaf there. 3 days I didn't pass a stool. 3 days. Belladonna. And tongue dry. Strong belladonna in ghat. Anyhow, so it's not a disease, it's a symptom. So, and in a female patient, periods have to be asked for. Every lady, every girl, every woman, you have to ask history of periods. And leukorrhea, white discharge. India, middle age, middle class women, everybody has got leukorrhea. White discharge, safed pani thoda hai? Hai. Nobody says no. That is because they don't know that normal people, normal women can have white discharge daily, where they don't have to change even the underwear. So they should be taught about that. And food and all. Are you vegetarian, non-vegetarian? And you see, what I don't like is, people want you to change. Change. Give, you're vegetarian? No. Your son is underweight, he's not growing well. Give him 2 eggs daily. because there is proteins, high protein. Yes, of course, 2 eggs is very high protein. You can get 10 grams of protein. Don't try to convert a vegetarian into non-veg. It will not suit, please. In Bombay Hospital, I was the editor of Bombay Hospital Journal for 35 years till last year. And 30 years back, some politician told our director, Jain, SP Jain, he was a very nice man, that तुम्हारे हॉस्पिटल में वेजिटेरियन खाना देते हैं, हाँ, तुम्हारा हॉस्पिटल 50 साल से चल रहा है, आपने कोई डॉक्टर ने वेजिटेरियन डाइट के ऊपर किताबें नहीं लिखी, बोलते अब तक आप जाए मार्केट में, दिस वाज अ फैक्ट, ऑल बुक्स ऑन वेजिटेरियन डाइट वर रिटन बाय नॉन मेडिकल पीपल. So आपका एक कोई डॉक्टर नहीं लिख सकता. So Babuji felt very hurt, and he urgently called a meeting of all honorees in the hospital, 250 honorees. I was not called, I am on the staff, I am the editor there. And he said, I am very upset. I want somebody to write a book on vegetarian diet. Who will write? All 250 heads down. Babuji got so upset. He was a very nice man. And at night, 12 o'clock, I got a telephone call from him. Kapoor Saab. I said, anything wrong? No. I want you to meet me tomorrow in my office at 9 o'clock sharp. I was surprised. What does he want? And I went there. He says, I'm very sorry. I didn't call you in that meeting where 250 doctors refused to write a book on vegetarian diet. So he said, at night, 12 o'clock, I remembered, Kapoor can write, O.P. Kapoor will write. So I've called you. Will you write? I said, yes, I'll write. Another point. There's a Congress, some meeting and all that. Politicians, after 3 weeks, I want his manuscript on my table within 2 weeks. Latest, 15 days. Yes, Babu. Okay. After 14 days, I put the manuscript on his table. The book was printed, Vegetarian Diet, and the first time by the doctor. 1,000 copies he gave to all politicians. Even I did not get my copy. But he rang up and said, Kapoor Saab, I want you to meet my trustees of Bombay Hospital, Birlas, Mrs. MP Birla. They all want to meet you because you wrote this book and it's a big name for us. So I went to meet that, and they all were very happy. Kapoor Saab, very nice, praising. Mrs. Birla, I was going away. She called me, Kapoor Saab, 1 minute. आप तो वेजिटेरियन है ना? नहीं माताजी नहीं. I called her माताजी purposely. ऐसे माताजी मैं वेजिटेरियन नहीं हूँ, मैं तो नॉन वेजिटेरियन हूँ, मैं तो प्रोफेसर हूँ, मैं तो टीचर हूँ. कल बाबूजी बोलेंगे आप नॉन वेजिटेरियन डाइट के ऊपर किताब लिखो, मैं लिख दूंगा. So everybody, they got a shock, and then suddenly they started laughing. I went to my office, and the next issue of Bombay Hospital Journal was on non-vegetarian diet. There's nothing. The tiger, lions eat flesh, only flesh, and they are the strongest in the jungle. But elephant is also the strongest. He eats only grass. He eats only vegetarian food. Every food has got some takat. You can't say this. Yes, but one thing I can do. The patient comes and he brings his son. He says, Doctor साहब ये देखो 12 साल का हो गया है, पतला ऐसा, वजन नहीं बढ़ रहा है, हाइट नहीं बढ़ रही. And he himself has got a big paunch. Patient, huh? Then I ask him, ये आपका पेट वगैरह तो आप कमती, आप दूध पीते हैं? हाँ, दूध तो पीते हैं ना. सुबह नाश्ते में बड़ा गिलास और सोने के टाइम पे बड़ा गिलास. This is a usual thing. So then I'll tell him, सुबह का दूध बंद, रात का दूध बंद, और वो दूध आप ये लड़के को दो. Finished. He gets nearly 25 grams of protein, and he gets calories. He puts on weight. So in the sense that there is nothing in the food which you should be very sticky, that don't eat chilies, don't eat the tea, coffee. Yes. Now these are bad habits. You want to know how much tea he takes, how much coffee he takes. Tobacco in any form, whether smoking, whether inside they put the thing, or gutka. You know, the Jain community were rampant gutka consumption, tobacco consumption, because they don't know that is bad. Nobody has told them. And all these tobaccos are as bad as alcohol, soft drinks, all junk food, salt, alcohol, everything is bad because they are not supposed to be taken. And so you advise them, they listen to you. Beer, somebody has got gout in the family. Beer, you take a few bottles of beer, 100% you will get attack of gout. So they can be told. This is personal history. All personal history patients, how many drugs they are taking. You must know which drugs they are taking. The commonest for GERD, they won't taking PPI drug. You know, long term they can cause side effects. Constipation is a result of most of the drugs which you should know, which you may be taking for diabetes, for blood pressure and all that, which you might have to stop if these symptoms develop. And then finally this sexual history. I'll finish with this today and we'll continue next time with the rest of the history. Now, as far as sex is concerned, I am not in any cult. I have no God-man, guru, but I only believe in God. I believe in God 100%. In fact, every prescription I tell the doctors also, believe in God. Every time you prescribe, below that, 1 second, remember God. Why? I have seen, I have experienced. I made the excellent diagnosis. I have given excellent treatment. The same diagnosis, same treatment in another patient did not work. Why? I don't know. So God. God has to help you. You know, when I started my practice, I wanted to become a pediatrician. So I did DCH. So I started as a child specialist years back, 1960. And within 2-3 weeks, one woman came, mother came with a small child. Small child, 3 years old, I think. And then she said, I have got 3 sons. This is the 3rd son. I've got 2 other sons. I said, you're very lucky, 3 sons and all. But there is a problem in this son. What is the problem? She removed this chaddi and showed the penis. That रात को वो like this she showed. रात को वो कड़क नहीं होते, ऐसा नहीं उठते. My God, I was shocked that she has observed that in other children at night time in their sleep, erection takes place. Today we are doing this as a test for sex weakness. You know, we have got machines where we can see at night, do you get erection? If you don't get erection at all, bad case. If you get erection, good case. So, why did God make this? I don't understand. The girls start menstruating, and these boys, moment they become 12, 13, 14 years old, depending on what they see in the TV and pornography, and that's a separate thing. The fact is that they start developing semen. And semen comes from prostate, seminal vesicles, all this. This God has made this. We have not made it. Now this semen should come out when it collects. How much it collects, that is different issue. You see pornography and all that, you will see it will collect daily. But when the semen collects more, at night, there is a night discharge. So that child, at night, in the morning he sees his underwear is wet, he has passed something. Now, he cannot discuss this with any father, mother. It's a very delicate point. When the mother sees in the morning that the underwear is sticky, then she knows that he has had a night discharge. So she'll tell the father, गड़बड़ है, आप देखो जरा उसको, वो लड़का खराब हो रहा है, लड़का खराब हो रहा है. And then they give them complex, these children. And these poor children develop a inferiority complex, they lose weight and whatnot. When they come to me, they bring for loss of weight, etc. I ask him, how often you get this night discharge? So he says, वो 10-15 दिन में तो होता है। अरे तुम्हारी उम्र में मुझे तो हफ्ते में एक बार होता था, क्या बात कर रहे हो तुम? इट्स नॉर्मल, गॉड हैज गिवन। ही गेट्स वेरी इम्प्रेस्ड। इवन माय डॉक्टर यूज्ड टू गेट इट व्हेन ही वाज यंग। इट्स ए नॉर्मल थिंग which your parents have become as abnormal. So you start taking good diet, take milk in morning, evening, and stop burning, puts on weight, it becomes normal. Then he understands, yes, night discharge is a normal thing. Although in our country, many UP, Bihar, some states, some Maharashtra, Gujarat, patients develop symptom of dhat. This is the only symptom of, in the whole world, which India we have got. Sexual symptom. I call it as male leukorrhea. Why? Because they think it is semen going out, and they become. It's not. It is chronic prostatitis. In chronic prostatitis, there is one delicate test, PSA, which is for cancer of the prostate. You do this very high in this patient, and this is due to infection, and again not common infection, herpes infection, herpes simplex, chlamydia, other organism, where you need antibiotic for 6 months, sometimes husband and wife. Incidence has gone down. Masturbation. So the boy starts masturbating, then he does it once in a month, once in 2 weeks, once a week, then develops complexes. Oh, I'm overdoing it, I'll become sexually weak. And in the end he starts losing weight. So when he comes and all that, I talk to him, I explain to him that semen is being produced. Either it should come out in night discharge, or you should have a girlfriend where you have abroad at the age of 11, 12 they start sexual intercourse in the schools, colleges. But then you're exposing yourself to venereal diseases and HIV, AIDS. Or you start masturbation. Nothing wrong at all. Masturbation is like having a sexual intercourse. Here without any woman and all that, the semen comes out, you feel it. And it's a relaxing thing. God has made this to relax you with all the tension of the whole day and this and that. When semen comes out, you feel markedly relaxed. Vice versa, there are in India, there are so many patients, you ask them, how often you have sex in the sexual history? And you know what they answer? they laugh like, डॉक्टर साहब क्या बात करते हो, 2 बच्चे हैं मेरे, 2 बच्चे हैं, अभी क्या sex? They think sex God has made to produce children. That poor fellows don't even know that what has children got to do with the sex. You produce 2 children, 6 children, but you're growing older, you become 40, 50, 60, at 6, you can continue having sex. Is there to relax you. So there is less tension in the body, you remain mentally healthy, mental health remains good. Well, next month we'll continue with the rest of the family, the other history, which should be obtained from the patient.